Hello, doctor. Good morning.
Good morning, Tracy from Stop and Regrow Hair. How are you?
I'm doing very well, thank you, Dr. Ray. How are you doing today?
Today better than yesterday, tomorrow better than today, Tracy. So we're sticking around. You've got a question from a patient that you discussed with over the weekend.
Yes, yes. So Dan is from Denver, Colorado. He's a fitness-focused startup founder, and he has started noticing something on his temples, actually. And he really wants to know why. So he eats very clean, he works out, he's very healthy, very health conscious. He's very skeptical of internet products. He's tried a few at home and none have worked so far. So he's wanting to understand the science of why hair loss happens and in particular why it might be happening to him.
Okay, very good. A lot of good information to go from there. So first thing we'll do is start with the number one question, I think, is why me, doc? I'm a fitness person. I bag my own groceries. I've got solar panels. I help the old lady across the street. I don't smoke. I work out. I eat my vegetables. I take a multivitamin. I stretch two days a week. I swim. I do calisthenics. What else can I do myself to stop this from happening? Okay. So first thing with Dan from Denver, we'll say first of all, I would say take a deep breath. I'd say welcome to Earth, and you pick up one of two bodies down here. You either pick up a female body or you pick up a male body, and the bodies are determined based on our DNA that God gives each one a unique code. But here's what we've learned so far for Dan, okay? And any male person in the world, okay, male. If you're male, you have an 80% chance of having hair loss in your lifetime. And I think you said Dan was in his 30s. Well, it can start in your 20s. Actually, we've got
Yes.
some patients that start at 16. So even younger, teenage kids will lose their hair. 20-year-old men will lose their hair 30, 40, 50, 60, 70, 80. By the time we're finished, 80% of men are going to lose their hair because they have a genetic defect, and every time each generation, there's just more and more and more of the defect. So it's been spread to almost everyone. I think by 2050, it'll be 90 some odd percent. So this 80%, the cause is genetic. Okay, genetics. That means DNA. So that means nothing you can do on the outside, nothing you can do will change your hair loss. Nothing you can do will change your hair loss. It is inside the genes, inside your DNA, inside every cell inside your body. It just so happens that the hair
So what can
cells
be done?
in the hair cells in your scalp can be reprogrammed with a different signal coming from your bloodstream. So this is going to say, I think Dan wanted to learn a little bit about science. Well, any patient out there that wants to learn a little bit about a science, you've got to learn a lot about science to truly understand. So the first thing you almost have to trust is that there is a signal, an energy signal that comes from a mixture of molecules inside your bloodstream that determine the DNA either growth or hair loss or withering away of cells are all determined based on the signals inside the bloodstream. And that's something that we've studied for the last 2 decades. And there is a signal inside the bloodstream. So for Dan and all men and women, so men 80%. But if you're a female, if Dan's has a female friend that is worried about hair loss, the females 40%. genetic. Okay. So today, this question will talk to the 40% of women in the world and 80% of men in the world that have the genetic hair loss. And we talked about that being the DNA inside the cell has a defect causing the bloodstream to have a signal that's out of balance. So inside here, you've got pluses and minuses. Your molecules have charges, pluses and minuses, but lots of them, millions and billions and trillions of molecules. But this positive and negative add up to be a certain signal. So you've got a hair cell here that wants to grow, and the DNA inside your hair cell is listening to the signal in your bloodstream. So for 80% of men and 40% of women, at a certain point in time in their age, this signal becomes a negative to the hair cell and it starts to wither away. And then eventually there's no hair there, you see? Now, I think the question you asked, Tracy, which was what can we do to make the hair regrow? And it's exactly here is where we're going to work. Inside the bloodstream, we're going to look collectively at all of the molecules that contribute to the hair cell's growth. That's something that we studied. And today we can increase the positives and decrease the negatives. So by the time the bloodstream gets to the hair cell, it's going to say positive to the DNA to grow thicker. So thin hair becomes thicker over time because we change the signal on the inside, and we change the signal by using a supplement that's based exactly on your bloodstream. So once we get your blood work, we then determine what capsule goes in your bloodstream to make the signal positive. Now, a lot of times people, Tracy, they wonder, they say, well, doctor, what kind of side effects happen from repairing stuff inside your body? And if you say it out loud, it kind of sounds silly. What side effects happen when you repair the molecular imbalance inside of your body? And the effects, not side effects, and they're not negative. These are known positive effects that happen. So once you have the signal on the inside to be good in the bloodstream, positive, not only are the hair cells, but then you've got skin cells that love this new chemistry. Then you've got muscle cells that love this new positive. You've got brain cells that love this new chemistry. So people come back to us after regrowing their hair. They say, hold on, doc, my skin looks better. My muscles are better. My energy is level. My focus is better. My anxiety is better. What did you put in that capsule? So the capsule, once again, is based on your blood work. So we put inside your bloodstream in a capsule what's going to optimize your bloodstream. Once your bloodstream is optimized, you should expect a lot of positive benefits, but no unknown effects from precision medicine because we precisely know the molecules. Now, this is more of an overview, right? Because if we wanted to get more technical with Dan, if he had, a medical degree or a science degree, biochemistry degree, we would talk about the molecules as far as the atomic structure. Right? Right. So carbons, hydrogen, and oxygen. And then we could show Dan or any of the patients how all the molecules in your bloodstream are based on carbon, hydrogen, oxygen. 99% of all the atoms inside the molecules are carbon, hydrogen, and oxygen. And we can show Dan and all the patients, once we get your blood work, we can teach you how these molecules change shapes to another type of molecule. And we'll show you how that happens. For example, one molecule turns into another molecule, and you might lose CH4, which is methane gas. Sometimes you turn into dihydrotestosterone, and you lose H2O, which is water. So the molecules today can be known and precisely measured, and then we can deduce what we need to do as far as changing the shapes of the molecules. So while you're taking the supplements, your bloodstream is repaired, sending a positive signal to the DNA. Okay? When you stop taking the capsules, your body goes back to making the defective enzymes and making too many of this molecule and not enough of this molecule, causing the signal to the hair cell to cause the hair to shrink. So this is a brief overview. Did that answer most of his questions, Tracy?
I think so. Yeah. So, yeah, because he did say that his brother and his father have hair loss too, similar patterns than him. But he did say that he really noticed it a couple of years ago when he was going through a very stressful time with his job. And so he wondered whether the stress was impacting his hair.
Good question, Tracy and Dan. Okay, so we described the 80-40%. 80% of men and 40% of women get the androgenetic hair loss that's inside your DNA, and there's nothing you can do about it. The other type of hair loss can happen very rapidly in several weeks during stressful periods of time, mental stress, physical stress. That can affect anyone. It used to affect about 1 to 2% of the population, but the last couple of years, that's increased to be about 20%. So today we're seeing a lot more of this second type of hair loss, and you alluded to it, it's stress, and that affects the immune system. So some kind of stressor inside his body has caused his immune system to focus on his hair cells and causing the hair cells to be ejected. So when he looks at his pattern of hair loss, he would notice that he would have shiny hairs instead of baby fuzzy hairs. So the genetic hair loss, once again, will thin hair over time, which can take years. Autoimmune can happen in days and weeks. Okay. The treatment for this type of hair loss is not an oral supplement to rebalance biochemistry molecules, because that's not the cause. Since the cause of this hair loss is immune related, we treat the immune system and we use a topical ingredient. Okay. The topical ingredient is applied to the hair loss areas, and then in about 3 to 6 months, you'll notice that the hair cells have come back. Okay. If the hair cells do not come back in 6 to 12 months, we move forward with a more invasive type of procedure, injections into the area to cause the immune system to allow the hair cells to regrow.
Okay. And so this topical, is this available over the counter or is it only prescription items?
Great question. So over-the-counter types of products would be things that you could make probably yourself on your kitchen cabinet. So prescription types of medicines have to use precisely one molecule and not the other molecule. 1% of one ingredient, a certain percentage of another ingredient, certain milligrams, just to be able to reliably make or manufacture that type of capsule would require science, which puts us into the pharmacies, okay? So any kind of topical that's really going to be effective will have to be precisely made and customized in a pharmacy. So that will require a prescription in the United States and Canada. I think in some places in South America, maybe not, but I think most places in the United States will require prescription to have ingredients to be prescribed to be effective.
What should Jason do if he wants to determine which type of hair loss he has, or maybe he has both?
Good question. So what's the initial step for Jason to do in regards to his hair loss? So step number one is to determine the pattern of hair loss. So for some people that don't want to move forward with getting blood work, that's okay. The first thing I would do is determine the pattern of hair loss. And the pattern of hair loss is determined based on the pictures or coming into the office for a microscopic examination. But I know that the people that are coming through your portal, if they want to send in their photos, we can do a pattern recognition for them and determine, number one, what pattern do they have? So from the pictures, we can determine if this is genetic or immune related, okay? And that can be done based on the pattern. It's either A, genetic, or B, immune. If it's going to be immune, you can get a topical. If it's genetic, then you know you're going to need the blood work. Labs, okay?
And is that because genetics, it can be different, right? There can be different genetic issues, not just one.
Okay? So topical, yeah, you could, and then from the pattern, you could determine that you have both, which is probably 60–70% of the cases. So you can get started on the topical immediately and then get your oral supplements made once you get your blood work.
Okay, that sounds like a good place to start.
Very good. Great. Get started with the blood work, and then we'll interpret the blood work and figure out what's going on. But it starts, like you said, with the pattern recognition, with sending in the photos, and we look at the 5 zones of hair loss, and we can talk about that next time.
Sounds good. Thank you, Doctor.
Okay. Thank you very much, Tracy.